Now for a forehead lift, there's about 5 different ways it can be done. You can have incisions behind the hairline, which go across from ear to ear and pull this up. You can go in front of the hairline, so it doesn't bring the hairline back. You can go within of the furrows of the brow, which also does a good job of elevating things. Men are particularly good for that because they usually are bald and don't have a front hairline. You can also have an incision just above the eyebrow, which would elevate that specifically, and that would heal and the least amount of trauma to the forehead. For eyelids, you can do an upper eyelid where you're taking away the extra skin and a little bit of fatty tissue in the corners, and then you bring up the eyelid. With a lower eyelid, it's mostly fatty tissue with a little bit of skin that's removed. The fatty tissue is what usually gives you the bags, and that's all smoothed out and tightened up, and it looks more youthful. For a facelift, the incisions go into the sideburn areas, sometimes coming across the bottom part of the sideburn, in and out of the cartilage of the ear, around the earlobe, and then onto the back of the ear and into the scalp. And that allows us to mobilize the muscle, which pulls this up this way. And the neck is also dissected, and that's pulled back that way. So you can see all this extra skin here goes out from behind the ear, and the muscles of the neck are tightened and elevated. The jawline is tightened and elevated, and the muscles of the mid-face are tightened and elevated, and then the skin is brought up separately.